Terlivaz is a vasopressin receptor agonist indicated to improve kidney function in adults with hepatorenal syndrome with rapid reduction in kidney function. How to use? The recommended dosage regimen of Terlivaz is 0.85 mg 1 vial administered intravenously. Days 1 to 3 every 6 hours. Day 4 assess serum creatinine versus baseline. If SCR has decreased by at least 50% from baseline, to continue Terlivaz 0.85 mg 1 vial intravenously every 6 hours. If SCR has decreased by less than 50% from baseline, dose may be increased to Terlivaz 1.7 mg 2 vials intravenously every 6 hours. Contraindications. Terlivaz is contraindicated in patients experiencing hypoxia or worsening respiratory symptoms, in patients with ongoing coronary peripheral or mesenteric ischemia. Precautions. Manifestations of Terlivaz overdose are expected to be similar to the adverse reactions described with therapeutic doses. In case of overdose, initiate close monitoring of vital signs, electrolytes, and potential ischemic events, and initiate appropriate symptomatic treatment. What are the side effects of Terlivaz? Terlivaz may cause serious side effects including hives, difficulty breathing, swelling of the face, lips, tongue, or throat, dizziness, weight gain, swelling, shortness of breath, cough, sharp chest pain, slow or fast heart rate, slurring of speech, chest pain or pressure, sudden numbness or weakness on one side of the body, rapid breathing, confusion, fever, chills, clammy or sweaty skin, and pain or discomfort. Get medical help right away if you have any of the symptoms listed above. Side effects of Terlivaz include abdominal pain, nausea, respiratory failure, diarrhea, and shortness of breath.